In 1928, a Scottish-born scientist by the name of Alexander Fleming would serendipitously discover penicillin. This would be the first naturally occurring antibiotic drug, as in not synthesized in a lab, discovered and used to treat those with infections. Fleming would leave for vacation and 2 weeks later upon return find his petri dish with Staphylococcus, a bacterial species he was experimenting with, the same responsible for staph infections, contaminated and overwhelmed by the growth of fungus. At first, Fleming thought his lab sample a waste, but upon further examination, he would go on to notice that the areas where the fungus colonies had germinated, the bacteria, the Staphylococcus, would effectively not be there, creating bacteria-free zones. The fungus that had grown was known as Penicillium notatum, and thus, Fleming coined the bacteria terminating compound from the fungus, the term penicillin. This would revolutionize medicine. For those of you who don't know, illness used to plague humanity. And when I say plague, I mean it. For example, in the Middle Ages, if not already dead, you would have typhoid. If not already dead, your brother would have cholera. If not already dead, your best friend would have syphilis. And if not already dead, your, wife, sister, whatever, dad, mom, would have dysentery. Bacteria and disease was just about omnipresent. Though thanks to medicinal advancements as such, and like penicillin, and other developments like improved water quality, better food preparation protocols, better overall hygiene, etc., we now live in a world where people could relatively frolic around wherever they want without the worry of impending illness and ultimately death. All right, so as you may or may not know, antibiotics and penicillin cover a vast horizon of applications. From killing bacteria to killing even more bacteria. Freaking antibiotics are fucking machines, dude. Like they're effective as shit, you know? And so what I want to do for today's video is list what I think are the most badass infections, bacteria, viruses, parasites, whatever, that penicillin as an antibiotic can, terminate, call it. Yeah. So let's get right into it. So for number one, we have meningitis. Meningitis is usually a viral infection, though it could also be caused by bacteria, fungus, and even parasites. To clarify in this context, the main difference between a bacteria and virus would be that in longevity, a virus would need a host to survive, whereas bacteria can survive independently. Meningitis can be caused by multiple different strains of bacteria, viral meningitis, and multiple different parasites. Meningitis derives its name from the symptoms that it imposes on its victim, inflamming the meninges area of the brain and down through the spinal cord. Meningitis most directly results in stiffening of the neck and severe headaches, of which people who've undergone the infection report headaches that, quote, feel different than normal. Meningitis also results in high fever, nausea and vomiting, confusion, difficulty concentrating, seizures and epilepsy, sleepiness and difficulty waking up, sensitivity to light, loss of appetite, skin rashes, irritability, and sluggishness. In severe cases, meningitis can cause permanent brain damage, hearing loss, amnesia, locomotive issues, kidney failure, can cause shock, can be carcinogenic, can cause allergies, can result in cognitive issues to, you guessed it, death. Interestingly enough, in my research, I've come to learn that the severity of meningitis often correlates to your way of contracting it. Viral meningitis often being less severe, whereas bacteria on that scale tending to be more. The National Health Service reports that 1 in 10 meningitis cases results in fatalities. The most extreme cases, meningitis can result in internal bleeding and paralysis, which is, pretty fucking brutal. Though thankfully, thanks to antibiotics like penicillin, its derivatives, and related, we are now able to eliminate, or relatively so, the threat of meningitis. All right, so second on our list, we have gonorrhea, which fucking hilarious name, by the way. is also known as the clap. Fucking stupid as shit. I don't know why it's called that. So gonorrhea is an STD, a sexually transmitted disease that stems from bacteria, affecting both males and females, though with slight difference and nuance. Gonorrhea most frequently results in frequent urination, discoloration of the penis, testicular pain and swelling, itching and soreness in the anus, inflammation of the genitalia, also known as PID, pelvic inflammatory disease, pain in the lower abdomen, fucking rectal bleeding, as in bleeding from your anus, to quote, a pus-like discharge from the penis, which could be colored green, yellow, white, reddish, or beige. Fucking crazy. Gonorrhea can also offset a woman's menstruation cycle, lead to a sore throat, increase the frequency and just quantity of vaginal discharge, and ultimately lead to infertility. In the most extreme cases, gonorrhea will obviously result in death, and pretty freaking crazy. If not properly treated, gonorrhea will literally, if it doesn't kill you, it will literally linger in your body for the rest of your life. So you're gonna have, like, I'm assuming from, you know, I'm dissecting the medical literature, just a freaking bloated penis for the rest of your life, for example. Like, that's just one of the symptoms. According to the National Public Radio, there are 2,300 gonorrhea fatalities per year. So kids, if this isn't an incentive to wear a condom or to deter from having sex with strangers, I don't know what is. And gonorrhea, according to the WHO, is just 1 in 30 STDs that someone can contract. All right, so next on the list is pneumonia, an infection caused by bacteria, fungus, or virus, in which the air sacs in the lungs expand and become filled with fluid or pus. Symptoms include coughing, pus, and mucus, what is known as phlegm, difficulty breathing, chills, fever, sharp chest pains, dehydration, fatigue, increased heart rate, increased heart palpitations, sweating, fast and shallow breathing, shortness of breath, confusion, nausea, vomiting, diarrhea, to strapping a victim up to a freaking breathing machine to finally death. Pneumonia is transmitted via airborne respiratory droplets, and it is diagnosed through blood testing and through x-raying. Yeah, that's pretty much it for pneumonia. I'm not gonna go too much in depth because this video is probably gonna already be pretty long, considering that we have one more infection that I wanna talk about. And just a little side note, I could personally give a fuck about COVID, like I always have given a fuck. But in my research, I've also come to learn that COVID could actually induce pneumonia, which is, you know, pretty freaking scary. So, you know, props to COVID in that element, in that regard. The CDC reported 47,601 pneumonia deaths in the year 2020. So last infection on our list that can be cured by penicillin is leptospirosis. Now, leptospirosis is a bacterial disease, get this, spread through the fucking urine of animals. And now you obviously, as a logical individual, a viewer of this channel might be thinking, well, how the fuck am I gonna get infected by a disease that is spread through such arbitrary means? You know, friggin' animal piss. And actually, fun fact, the transmission, the contamination, the infection comes about indirectly, by which this animal urine ends up contaminating either food systems, aquatic systems, or soil systems that we rely on. Leptospirosis can be classified as a zoonotic disease, meaning a disease that can be spread from species to species, so from animal to human. And leptospirosis can notably linger around aquatic systems for months on end, which might explain some of its transmission and just how prolific it is, why it's prolific in the first place. Though leptospirosis most commonly develops in mammals, it could also infect fish, crustaceans, amphibians, and reptiles, and it can even affect avians, just that only when young, and when they develop this this infection, this chance of development no longer exists. Leptospirosis symptoms include high fever, headache, spontaneous bleeding, muscle pain, chills, red eyes, also known as conjunctival suffocation, nausea and vomiting, fatigue, diarrhea, skin rashes, sore throat, joint pain, and abdominal pain. In severe cases, leptospirosis, if it reaches any of the major organs, can result in organ failure, death, and internal bleeding, or also known as internal hemorrhaging. Leptospirosis may also lead to liver and kidney damage, to respiratory diseases, and even meningitis, which, as we mentioned, is the inflammation of the meninges surrounding the brain and down through the spinal cord. The CDC reports 59,000 yearly deaths due to leptospirosis. Yeah, so that's the list I compiled. Let's all thank Alexander Fleming for irresponsibly leaving on a 2-week vacation to Suffolk and unintentionally pioneering medicine. Good shit, Alexander Fleming. Let's go.